Hi, my name's Chelsea. I'm the nurse practitioner working with your provider today. I wanted to come in and discuss with you your new diagnosis of aortic stenosis, what it means, how it happens, and how we manage it. So first, it's super important to understand just the basic function and structures located within the heart. I have this little diagram here. I'm not sure if you can see that okay, but essentially the heart's a strong muscle and it's got four chambers, two upper chambers called the atria and two lower chambers called the ventricles. It also has four valves, which you can kind of see here, that help keep blood moving in the right direction and prevent it from backflowing. And we'll come back to that in just a second. The heart kind of works in two circuits. So you've got the right circuit here, which pumps blood to the lungs to get oxygen. And then it comes back to the left side of the body and gets pumped out through your aortic valve here and the aorta out to the rest of the body to deliver oxygen to the tissues. So your aortic valve located right here is a really small but mighty structure that opens and closes to let blood flow from your heart to the rest of your body. Over time, this valve can kind of narrow in a condition called aortic stenosis. Essentially, tiny amounts of calcium kind of build up. It's the same mineral that's found in your bones. It just starts to collect on the little leaflets located within the aortic valve. And this process happens really slowly, usually over decades of time, and eventually the calcium makes the valve really stiff and harder to open, which restricts that blood flow, making the heart work a lot harder to push blood through a smaller opening. So you can kind of see here, this is a normal valve, what it looks like when it's closed and open, versus a stenosed valve, what it looks like when it's closed and open. So you can see that the opening is a lot smaller. So just like lifting weights at the gym causes your muscles to grow, the extra strain on your heart having to work so much harder to push that blood out to the rest of the body can cause the left ventricle to kind of thicken and just become stiff and weak over time. So risk factors for this calcium buildup that causes aortic stenosis include aging. That's really the biggest risk factor. Like I mentioned, it just happens over time as we get older. High blood pressure and cholesterol as well. Conditions like kidney disease, diabetes, rheumatic fever, if you've ever heard of that. That's just an infection that can cause scarring within the heart, especially on the valves, which increases those calcium deposits. And then genetics. Some people are just predisposed to developing aortic stenosis, whether it's early on in life or later on in life. And so there are ways you can prevent the calcium from building up. We can't completely stop it, but there's steps you can take to slow it down. And that includes controlling blood pressure and cholesterol, eating a heart-healthy diet, so like lots of fresh fruits, vegetables, lean proteins, and limiting the intake of processed and fatty foods. And then staying active is super important as well. Regular exercise to kind of keep your health keep your heart strong, and then smoking is a huge risk factor as well. So stopping smoking or cessation of smoking is really important. And then if you have kidney disease or diabetes, just properly managing those conditions can also help reduce further calcium deposits on the valve. Symptoms of aortic stenosis, some people experience them, some do not, just kind of depends on severity, but that can include chest pain or a feeling of tightness in the chest, feeling faint or dizzy, especially with activity, shortness of breath, fatigue, and then a rapid or irregular heartbeat. And if it's left untreated, it can lead to serious complications, including heart failure, stroke, or irregular heart rhythms. As far as diagnosis goes, it's kind of a lengthy process. We usually do an EKG just to kind of check out the electrical activity within the heart, make sure that's looking okay. An echocardiogram, which is an ultrasound that kind of sees how blood is flowing through your heart. We can also do things like x-rays to look for an enlarged heart, and that will actually show calcium buildup. We usually do a cardiac stress test, and that just kind of evaluates how your heart responds to activity. We can can do further scans like a CT or MRI just to get more detailed pictures. And if it's severe enough, we can also do a cardiac catheterization procedure, and that's just more advanced and invasive test to assess severity. And then as far as severity goes, there's 4 stages of aortic stenosis, starting with stage A. This just means you're at risk for the condition, but you don't actually have any narrowing yet. Stage B is mild to moderate narrowing. Stage C is severe narrowing, but no symptoms present. And stage D is severe narrowing with symptoms present. The good news about all of this, and I know it sounds really overwhelming, is that there's ways to manage and treat aortic stenosis. So like we already kind of discussed, just prioritizing heart health, and we can also initiate medication management that can help control blood pressure or treat any arrhythmias that may be present, and then reducing fluid buildup to kind of ease that strain on the heart, and we do this through diuretics. In severe cases, surgery is usually indicated. So for adults, the most effective treatment is actually a valve replacement, and that can be done through open heart surgery or a much more minimally invasive procedure. So like I mentioned, I know it sounds really scary, but with the right monitoring and treatment, most people live full, active, and healthy lives with aortic stenosis.